Good day. I'm John Supplett, Senior Director of Rural Health Services for the American Hospital Association. Today, we discuss access to behavioral health services across rural America. Whether for mental illness, substance use disorders, or general behavioral health, access to care is limited, and in many communities, not available. Not only are rural communities clinically underserved, but even where tele-behavioral health is an option, there may not be sufficient broadband capacity. With me today are three leaders who have found a way to deliver behavioral health services, and each uses a different approach, which they will explain. Please welcome Alan Van Driel, CEO, Smith County Memorial Hospital, a critical access hospital in Smith Center, Kansas. Dr. Scott Smith, CEO and Medical Director of Adams Memorial Hospital, which is a critical access hospital in Decatur, Indiana. And Doug Foss, CEO, Ivinson Memorial Hospital, a 99-bed PPS hospital in Laramie, Wyoming. Gentlemen, a great many rural hospitals do not provide behavioral health services, and I'm going to keep this simple and ask each of you the same two questions. That is, how do you provide behavioral health services in your community and why? And second, what is the biggest obstacle to expanding access to behavioral health services in your community? So Alan, let's start with you. How do you do it and why?
Well, John, Smith Center is a very rural community, a frontier area in north central Kansas. And the problem that we've had for a long time with behavioral health services is simply the lack of professionals in the area. Kansas is highly rural, particularly the western two-thirds of the state, and there just are no providers of behavioral health services in the area. So while we see it as part of our mission to provide all services to the community and the surrounding area, we had no availability of professional providers to do that. We did, however, have the availability of decent broadband connectivity within the area. So we started looking at opportunities to partner with other organizations to develop tele-behavioral health. And we have actually several partners now that we've actually put together a conglomeration of services, both emergent and ongoing, for behavioral health services. So we just see it as part of our role in the community to be able to provide that.
Well, and I appreciate that, and it's good to hear that you're taking advantage of the resources that are available to you through broadband. So tell us then, what is the biggest obstacle to expanding access in Smith Center?
Well, I mentioned that we've put together several partners that we use to deliver the services. The biggest obstacle is the availability of those providers, the willingness of them to use telehealth technology to provide services, and to a big extent, the licensure issue for behavioral health for all providers really in a rural area. Often telehealth in general breaks down some barriers of distance so that we can use professionals in other areas. We sit right on the Nebraska-Kansas border. We do access services from outside the state, but licensure is an issue. So that state line sometimes becomes a very, very high wall. So that's probably the biggest thing is the licensure issue. The willingness of providers to participate with us is somewhat of an issue, but becoming less so. But payment is also an issue. During the pandemic, obviously there were some waivers put in place that allowed us to deliver behavioral health by telehealth, and there's some danger now that some of that flexibility may go away, so that's a barrier also.
Great, that's very helpful. Thanks for bringing up those issues. So we see in this first case that the mode of delivery is telehealth, and the why is they are mission-driven. So Dr. Smith, you're next. Can you share with us how you do it and why?
Sure. Thank you, John. At Adams Memorial, we are a county-owned, independent 25-bed critical access hospital in Decatur, Indiana. And as a county hospital, our behavioral health team is committed to providing mental health and substance use disorder care for the residents of Adams County. And we actually see behavioral health as an extension of our primary care offices. We have several primary care locations across the county, and in 2 of those clinics in the medical office building, we also provide behavioral health services in person and some telehealth as well. So we try to integrate our behavioral health with primary care and make it accessible to the community members, in fact, regardless of their ability to pay. So this aligns, like John, with our organization's mission and vision. We want to be the trusted healthcare partner for the community, so we feel like providing this service is important in that effort. We provide on-site services in our offices and also some off-site services with contracted locations. For instance, during the academic school year, we provide counseling for students at the local school district in person and on their campus. We also contract with local employers for employee assistance programs for their staff, and even provide counseling for inmates at the local county jail with substance use disorder and mental health issues. So multiple settings, our team provides both counseling and medication management. We have counseling down to individuals 5 and older, and medical management for those 12 and older. So we're thankful we can provide that from childhood through the senior living population in our community. So the financial commitment for that is substantial for the organization. Ultimately, if the services were judged only on the basis of the financial bottom line, we would not be able to continue. But with the growing demand of behavioral health and substance abuse treatment needs across all the age groups in our community, we make it a choice to provide those services despite the financial challenges.
Well, in listening to your description, it's such a broad-based mission that you have as a county health system, in essence, and everything from kids in school and the school districts to outpatient to employers and then the jail. It's really quite a contribution, and I was imagining that finances or reimbursement would be among the biggest obstacles to access. Are there others?
It's definitely the biggest. I think the workforce challenges, as Alan mentioned, are a concern as well. I think that it's a combination of those obstacles, the reimbursement and the workforce. As far as reimbursement goes, our payer mix is about in behavioral health about 30% Medicaid, 15% Medicare, 35% commercial insurance, and 20% self-pay. Not much different from what we see otherwise, but with that, we imply licensed mental health providers that includes master-level social workers, bachelor-level social workers, case managers, and also providers, so certified nurse practitioners and APPs. So. But the key is having that engaged expert workforce in behavioral health who's committed to practicing in a rural community and focused on that whole continuum of care and collaborating with primary care. So that's where we see the real value. And that workforce in behavioral health, just like the rest of us in healthcare over the past 2 years, they are stressed, they are depressed, they are anxious, they are feeling all the same stressors as their other healthcare colleagues. So as healthcare leaders, we're trying to just really focus on supporting that workforce and the self-care aspects that we've always emphasized, but now we realize it's even more important for our behavioral health staff.
Dr. Smith, that's very helpful to know, and it sounds like you have a pretty decent labor pool from which you can draw, and we'll have to tap into that a little deeper later. At this point, I want to turn it over to Doug. You're up, and so tell us, how do you do it in Laramie, Wyoming, and why?
Well, very similar to what I'm hearing from the other panelists. In Wyoming. There's only one state school in the whole state, 4-year school. So Laramie is it, University of Wyoming. So a lot of things make up our community. We just have our local community that we serve, but we feel like we serve the whole state because lots of kids come to Laramie. And so that's a big piece of what we offer. We offer an inpatient behavioral health unit, and it's 10 of our 99 beds. And I'd say about a quarter of them are actually students from University of Wyoming. So it's a big piece of what we offer, not just to our local community, but to the state, which we're the smallest population state in the United States with about 500,000 residents. So that's a big piece of what we do. We also partner a lot with other agencies in the community. Right as COVID kicked off, we had really put a lot of effort in to start to think about how we can do a better job in behavioral health. COVID kind of slowed us down through that process, so that's something we're starting to kick back up again. But anyway, that's been the main focus for us. We've had the history of having that inpatient unit for a long time, and thankfully financially, like Scott mentioned, it doesn't make us money, but we feel like it's a big piece of our mission and what we do in Laramie.
Well, and I'm hearing the mission story over and over again, and I'm hearing it takes very broad shoulders in Wyoming, given that you are looking at your market area for this purpose to be statewide.
Yeah, it definitely is a challenge. But I think we've had a real stable workforce when it comes specifically to behavioral health. We've had the same psychiatrist for the last 10 years, and that's been a huge piece of our success. And then on weekends, we use nurse practitioners to help us, and we've had good stability there as well. But that's the part that scares me the most about the future of behavioral health with us as well, is just trying to recruit providers and to keep people retained and engaged. We're always worried about payer sources, and that's no different than anybody else. And then just making sure we have got the right access. It's a huge relief valve for our emergency department, where people know that if somebody's in trouble and in crisis, that we can place people up on the behavioral health unit, and we have a lot of success, and we do have some people return. So it does show you a big weakness in our community with the outpatient side of things, where if that was a stronger piece, maybe the inpatient unit would not be needed as much.
I have to say, our time is short for this discussion, but this has been a very interesting conversation. And as Doug has pointed out, in Laramie, they provide inpatient psych services. And again, the why is your mission driven. So each of you also identified the greatest obstacles to expanding access are reimbursement and clinical capacity, licensure, some teletech issues, and others. And none of us are really surprised by either your motivation or your challenges. Nevertheless, and unlike many of your peers, you have overcome these obstacles, at least in part, to meet the mission of your community of providing an essential service. Well, I have many more questions, but time prohibits us from diving deeper. Perhaps we can do that at a later date, and you can share with us how you defied the odds to make behavioral health accessible to your rural communities. Until that time, I want to thank Alan Van Driel, Dr. Scott Smith, and Doug Foss for sharing their stories. I'm John Supplett, and this has been an Advancing Health podcast.